Hey guys, welcome back. Today, let's talk about the dreaded postpartum hair loss. My name is Dr. Jenny Liu. I'm a board-certified dermatologist and welcome back to my YouTube channel. As you guys know, I'm currently expecting in my second trimester, and after delivery, like most moms, I'm going to be experiencing some major hair loss. And so I thought I would take this opportunity to discuss with you guys, when does it happen, why does it happen, and what are the things that we can do to minimize the hair shedding and hair thinning. So postpartum hair loss can be so frustrating, as if it's not enough that our body have gone through so many changes during pregnancy and continue to go through changes during postpartum. We add on top of that sleep deprivation, having a new baby on board, and just adjusting to the new life that you have. The next thing you know, you're noticing clumps of hair coming out on your comb, the shower drain, and on the floor. But I want to let you guys know that this is a very natural part of postpartum recovery, and majority of moms does experience this. The good news is it's not permanent, and for majority of moms, it is reversible. So why does it happen? Well, the medical term is called telogen effluvium. Essentially, what's happening is that during pregnancy, your body, with all the hormonal changes of growing and supporting the growth of your baby, you have more estrogen. That estrogen, actually, what it's doing is prolonging the growing phase of your hair. So when we look at our hair, we all have a certain amount of hair that's in the growing phase, a certain amount that's in the resting phase, and a certain amount that's in the shedding phase. And that is just a natural hair cycle that all of our hair will go through, all of us on our scalp, whether you're pregnant, whether you're male or female. And obviously there are certain things that can tip you into losing more hair temporarily, or say to grow more hair. And pregnancy is one of those times where you actually have, to your benefit, hormones that is pushing your hair to basically rest in that growing phase. And what's happening postpartum is that with the hormonal changes and drop in estrogen, you just have more hair shifted back into that resting and shedding phase, and bam, when it all hits, you notice more shedding and diffuse thinning. Now for telogen effluvium, most commonly it occurs 2 to 3 to 4 months postpartum. And this telogen effluvium is a medical term that it doesn't just apply to pregnancy. It can happen after a major illness, like for example, COVID. It can happen due to a major stress, major illness, even changes with medications. And the reason why it's a delayed onset after the inciting event, whatever that may be, has to do again with just the natural hair cycle and the time of your hair cycle. Now for majority of moms, they will notice this more excessive shedding about 3 to 4 months after having a baby. The majority of moms will actually notice improvement, about 80+% if they do nothing about it 5 to 6 months later. So it is something that for majority of moms that is reversible, and it is not permanent. Now the other things you want to keep in mind, in addition to just the plain old hormonal changes that's happening, add on top of that, if you're a new mom, the shock of sleep deprivation, learning to be a new parent, also just the changes that your bodies are going through. And if you're breastfeeding, and if you went through a more challenging recovery postpartum, your body may be recovering. You may be, say, iron deficient or anemic, and you certainly need more vitamin D if you're breastfeeding. And so deficiency in those vitamins can also be contributing to hair loss as well, on top of just the lifestyle changes that you're experiencing. So having said all of that, what can we do about it for the hair loss? As I mentioned earlier, for most moms, it is reversible even if you do absolutely nothing. I know it's really hard to sit through and watch just clumps of hair falling out, clogging the drain, and your ponytail density diminishing. But if you don't have the resources or the time to do anything, like I said, for most moms, it is reversible, and usually you will notice hair growing back, assuming there's no other underlying conditions that may be contributing to your hair loss, usually about 6 months or a little bit longer postpartum. But if it is something that's really bothering you, these are some of the things that you can consider that can be safe even if you are breastfeeding. But I am going to caveat this with the fact that you should always discuss with your provider first, especially if you are breastfeeding, and especially if you're going to be taking any supplements that may impact your breast milk supply or may even be excreted into your breast milk. So the first thing you can do that that is helpful, that is relatively safe, is to use topical minoxidil. Topical minoxidil is one of the really best available over-the-counter treatments that we have for growing hair. And in fact, it's probably one of the best studied treatments that we have. I know it's really approved for male and female pattern hair loss, but as dermatologists, we use it off-label to treat various different types of hair loss. And in fact, if a patient comes into clinic to see me for telogen effluvium and they really want to do something about it, I recommend topical minoxidil. It is something that you do have to use on a regular basis, and for most individuals, something that you have to stick to for at least maybe 3 months or longer before a noticeable result is seen. And there can be, in the beginning for certain individuals, this more rapid shedding that has to do with the medication synchronizing their hair cycle, and that can freak people out. But if you stick with it and continue, you will notice improvement. Now, a couple questions I always get about the topical minoxidil. Number one is, do you have to use it forever? Well, if it's truly in the setting of postpartum hair loss and you don't have any underlying female or male pattern genetic causes of hair loss, then no, it is not something that you need to use forever. And the hair that you do grow on using minoxidil will not just fall out after you stop. But sometimes postpartum hair shedding can unmask or bring out in certain individuals a genetic predisposition to that pattern hair loss. And if that is the case, then minoxidil is something that you may have to use on a more long-term basis to sustain the hair that you've grown while using it. And sometimes that pattern is not always very clear. And this is where, if you do notice more shedding after stopping, seeing a dermatologist for a more formal evaluation and proper diagnosis can be very helpful in that situation. Now, the other question is it safe during postpartum, especially if you're breastfeeding? So we know that oral minoxidil has been used rarely in moms postpartum, especially in lactating moms. Obviously, we don't have enough data, but it is believed to be safe, especially the topical formulation, because very few amounts of it penetrates past your skin to get into your breast milk. The only thing that you probably want to just double check with your pediatrician is that it's probably not the best idea to use if you're lactating and you're breastfeeding a premature infant. So that has been noted to potentially cause issues. So if you have a healthy full-term baby, minoxidil is most likely going to be just fine. One thing I do want to add is that when you're shopping for minoxidil, I recommend the 5% foam for everyone. 5% is the most effective regardless whether you're men or women, and the foam version is going to be the best, most elegant formulation, but also going to be the one that's going to be the least irritating on our scalp. And it has more of a mousse-like texture. The other formulation comes in as a solution, like a liquid. Sometimes it's cheaper, more affordable, but often that solution, the vehicle, can be more irritating on the scalp. So I always recommend, if you're able to afford, the foam formulation, but for sure, regardless whether it's the foam or the liquid, go with 5% over the 2%. Another option is what's called low-level laser therapy, or LLT in abbreviation, which you may have seen. And these are essentially laser devices that have been cleared and approved by the FDA to be safe to use at home. And the two that I recommend to my patients is number one, eye restore laser, which is literally like a helmet that you wear on your head. Another one is called laser Hairmax comb. And it's basically a comb, a device that you would move around your scalp to treat. And essentially, these use low levels of laser energy. We don't know exactly how it works, but what we think is happening is that laser energy at the lower level is safe and it's not going to be harmful anyway, but it's enough to stimulate metabolic function, mitochondrial activity, generate certain chemicals like, for example, nitric oxide that may have a role in metabolism, generating energy. Essentially, down the road, we think maybe bring more nutrients to the cells, and in a way, potentially similarly to how minoxidil works. And there are actually a handful of good studies showing that these laser hair devices works really well for, again, male and female pattern hair loss, but in general, just stimulating hair growth. Now, these devices can be expensive, and it's certainly something you would have to invest in. And again, with most treatments, something that you kind of have to commit to. Usually they're done, like every other day, 3 or 4 times a week. Usually each treatment is about 20 minutes or so. So something you kind of have to stick to, and you have to do it for about 3 to 4 months to have a good noticeable result. But the benefit is that the laser is safe and you're not putting anything on your skin. So if you're worried worried about potential absorption, this is not going to be the case. Now, I always get asked about supplements. What can we take? Well, first and foremost is just taking care of your body, making sure you continue with your prenatals, your calcium, your vitamin D, and if you are, anemic, taking iron as needed. There are hair supplements that exist that have been based on the company's claims to be safe during lactation. Now, the two that I recommend in general to my patients for hair loss is Nutrafol and Viviscal. To patients who are not pregnant and who are not lactating. It contains a blend of marine collagen complex as well as other proprietary blend of vitamins and antioxidants that have good data in helping to support hair growth. Now, when it comes to postpartum, if you are breastfeeding, Nutrafol has a lactation safe supplement. But again, just because the company claims that it's safe during lactation, we know that certainly supplements themselves are not without harm. For example, Biotin has been shown to cause issues with thyroid hormone labs and other things. So it is something certainly I would recommend you discussing with your provider first, especially if you're breastfeeding, before jumping into taking them. If you are interested in taking supplements, the things that are going to be helpful just for your body to recover and certainly will indirectly help with just overall health and hair growth is just a multivitamin, your calcium and vitamin D, extra vitamin D, especially if you're breastfeeding and if you're not supplementing your baby with vitamin D, and then iron and zinc. And those are the ones that can play a major role in hair loss and certainly are not going to be helpful with your hair growth if you are low in those nutrients. The other thing to think about is making sure you check your thyroid, because for certain individuals, pregnancy can either throw you into having that imbalance, and if your thyroid hormone is off, that can certainly play a role. So checking, making sure your thyroid hormone is normal and supplementing if necessary is also going to be really important. I also want to just briefly mention that in office, your dermatologist can prescribe certain medications as well as procedures that can supplement and complement what you are doing at home. For example, if you have a history of female pattern hair loss, spironolactone can be a safe and effective treatment. It works really well with topical minoxidil as well as laser hair devices I mentioned earlier. And this is absolutely safe to take during lactation. You want to just make sure that you have a well-established milk supply first, as well as off-label uses of microneedling plus platelet-rich plasma. And those are, again, out of pocket, but certainly procedures that have been shown to really help with improving hair density and fullness. And lastly, I just want to offer you guys some of my personal tips. Everyone has a different experience during pregnancy and postpartum, and certainly postpartum hormonal changes as well as mental wellness and that postpartum blue can affect many of us on different levels. And certainly the way we feel about ourselves, our body image can impact our overall mood. And I think for me personally, adjusting to my new body was a challenge, the sleep deprivation, and then all the hormonal changes with my skin and the hair loss. So one thing I want you guys to do is really just take it easy on yourself. Understand that this is just a phase. For most moms, things will get better and it will recover. Being kind to yourself, taking care of yourself, and seeking help when you need to, whether it's help with cooking, cleaning, helping to watch the baby so you can rest, or seeking a more advanced help in talking about your mood or your mental well-being. I think that is so important. So self-care is by far the most important thing that you need to be doing postpartum. The other things you can consider that is going to be helpful with just overall hair health and improving the hair thinning is number one, consider also adding into your regimen volumizing shampoo. These, although are not really going to be helpful in truly growing hair, it can certainly help to add some temporary fullness. A lot of the volumizing shampoos will contain hydrolyzed protein that just adds protein to your keratin, which is the part of your hair, and that will temporarily increase fullness and volume. Brands, for example, Nioxin, as well as some of my personal favorite brands for volumizing shampoo. The more pricier end is Living Proof, their volumizing line, as well as one that you can find at Target, OGX Biotin plus Collagen, and that is just going to help to temporarily add more fullness to your hair. Also, be mindful of how you style out of your hair. I think we're so used to, as moms, neglecting our self-care in many ways, and it's so easy for us to just throw our hair in a bun, in a messy, tight updo, whatever, to get it out of the way, so that way we can do our daily tasks to feed the baby or clean, whatever. But long term, if you put your hair in a tight braid or in the same position, that tension can certainly cause potential hair thinning over time. Certainly is not going to be helpful for the overall health of your hair. And along the same line, minimizing the heat that can contribute to hair damage and hair breakage, making sure that you're using heat protectant spray, sunscreen, and a hat when you're taking walks with your baby outside, because ultraviolet damage to your scalp can cause inflammation, and that we know can induce hair thinning just naturally over time, and that can also cause hair breakage as well. And then making sure that you are keeping your scalp healthy. One shampoo you can certainly add in, even if you have very mild or minimal dandruff, is Nizoral over the counter. Ketoconazole has been shown to actually help with hair loss, especially when used together with topical Minoxidil. We do think that the buildup of yeast and sebum can lead to inflammation. Again, that can contribute to just an unhealthy environment that's not really conducive to hair growth. Lastly, consider a new hairstyle. I mean, this is the time to change up your looks and consider something new. So make it fun, make it you, and most importantly, I want you guys to understand that this is a temporary phase. I want you to feel comfortable in the new body, new skin, and the new hair that you have. And ultimately, if trying these things, you're not really achieving the success, the improvements that you are wanting, please follow up with your dermatologist, because there can be a lot of nuances that goes into hair loss, and certainly checking, having a formal evaluation, testing done, and appropriate treatment is really going to be important. I hope you guys found this video informative and helpful. Please comment below with your postpartum hair journey, what you've done and have worked well for you. Again, I would appreciate it if you could like this video, give it a thumbs up, and subscribe to my channel. Also, let me know if there's any other pregnancy or postpartum content that you want me to discuss, and I will see you guys next time. Bye.